Good morning, everyone, and welcome to our Healthy Food Hospitals kickoff event. We're very pleased to have you with us this morning. I'm Brian Peters, the Executive Vice President of Operations at the Michigan Health and Hospital Association, an organization that's dedicated to representing all Michigan hospitals and the patients and communities that they serve. I would first like to thank Sparrow Hospital for graciously serving as our event host this morning. And as you'll see in just a few moments, we're here at Sparrow due in part to their tremendous leadership on this particular effort. At issue today is obesity. Obesity is an epidemic here in the state of Michigan and frankly across the country. Obesity, including pediatric obesity, is leading to a dramatic increase in healthcare costs throughout the state of Michigan. It is leading to a degradation in quality of life for many of our individuals and families, and certainly it has a negative impact for Michigan's business community in terms of the impact on productivity, absenteeism, and the like. And so the question becomes, what can we as hospitals do about this very serious challenge? It's interesting to note that here we are just a few short blocks from the state capitol building today, and yet we're not here to ask for new funding. We're not here to ask for any change in the law or a change in the regulatory structure. In fact, we are here to demonstrate the commitment of Michigan's hospital community to sending the right message, doing the right thing in a voluntary fashion. We're very excited about the opportunity to lead by example, and frankly, this is a continuation of the very positive track record we've established over the last few years. First, in terms of voluntarily eliminating smoking from Michigan hospital campuses, then voluntarily eliminating industrial trans fats from hospital food service programs. This continues that very positive move towards community health improvement for Michigan's families and communities. This concept for healthy food hospitals was developed by a work group at the MHA with partners from throughout the state, experts in dietary issues. We partnered with the Ecology Center in Ann Arbor, and we partnered with the MHA board, CEOs of our hospitals and health systems throughout the state who saw and recognized the value of community health improvement and the importance of hospitals leading the way. We are very fortunate today to be joined by three speakers who will help to explain the obesity epidemic and our direct response to it through the Healthy Food Hospitals initiative. Olga Dazzo is the director of the Michigan Department of Community Health. Ruth is the Chief Operating Officer of Sparrow Health System, and Christa Byrd is a registered dietitian here at Sparrow and also serves as the co-chair of the MHA's Michigan Healthy Food Work Group. At this point, it is my great pleasure to introduce someone who has been very supportive of our efforts to combat obesity. In fact, Governor Snyder, as you well know, has identified obesity as one of his administration's dashboard metrics, something that we need to improve upon here in the state of Michigan. Again, my great pleasure to welcome the Director of the Michigan Department of Community Health, Olga Dazzo.
Good morning, everyone. How are you doing? Are you having a healthy morning? Well, I am thrilled to be here at Sparrow, coming back to my roots where I spent many years working in different capacities, and I would like to congratulate Sparrow for being a leader in wellness and improving the health status of our population. Most recently, Sparrow announced its smoke-free among workers. And that is just commendable, and what they are doing with MHA's 4-star program is equally tremendous. I really congratulate Sparrow for doing this. So thank you, Brian, and thank you all for coming today. So I'd like to talk about how serious is the obesity crisis in America. So let me give you a few facts. Obesity costs the U.S. healthcare system $14 billion a year in direct healthcare costs. And according to the Healthy Kids, Healthy Michigan initiative, Michigan's annual medical costs associated with obesity total more than $3 billion. And there's, as you know, our healthcare dollars are precious. There's no need to throw them away. Childhood obesity is among the nation's most costly and complex public health threat. Currently, 1 in 3 children in the U.S. is overweight or obese, including 12% of Michigan children aged 10 to 17. And not only is a problem of wasting dollars, but look at what it's doing to the children. Our children today will not, if we continue with this obesity crisis, they will not live to the same longevity that we, all of us, have achieved. And that is a very sad commentary after public health and healthcare systems and everyone has worked so hard in increasing longevity in our country. So this is something that we must do something about. Now, nearly 30% of our adults are obese, and Michigan is 10th most overweight state in the country. So 10th most. So we're going to have to do something about this. Obesity is a major contributor to cardiovascular disease, cancer, diabetes, and it also impacts dementia. And you know, there's nothing that can be done for your brain right now, right? So obesity impacts just about every organ in your body. So it's very serious. As you can plainly see, it is in fact an epidemic. That is exactly why Governor Snyder included obesity in his Michigan dashboard. Have you all seen the Michigan dashboard? We have obesity and infant mortality from a health point of view there. From Governor Snyder's perspective, a state's obesity rate is one of the indicators of prosperity and quality of life, the greatest potential of which can only be realized when citizens are healthy. One of the easiest ways to calculate your level of wellness regarding weight management is to calculate your body mass index, or BMI. Weight and height are used to calculate BMI, which provides a reasonable indicator of body fat and weight categories that may lead to health issues. Individuals with a BMI of 30 or greater are considered obese. Now, Brian, you spoke of leading by example, and those of us in the healthcare community must be willing to be authentic and to practice what we preach. Well, I can tell you that when I first accepted this job as Director of Community Health, I was in fact obese. My BMI was over 30, and I just brought it down last week. I lost 20 pounds. So I'm now overweight, so I need to continue working on it. But just think about it. We think of ourselves, you know, obese, maybe that's for folks who are essentially bariatric, but no, I mean, just think about it. Look, do your numbers, look it up. You're over 30. That means your organs are going to start to fall apart. So, so take a serious look at it. So, when I learned this, I went on a weight management program, and I am happy to tell you that I'm doing it, and I look forward to coming to Sparrow and seeing healthy foods on the menu. Because when I go to restaurants now, I always, you know, try to find things that are healthy for me to eat, and all I do is a balanced diet. But it's always good to find things that are palatable and healthy on any menu. So, the Snyder administration is pleased to see Michigan hospitals assuming a lead role in the fight against obesity, and we're very appreciative of that. All of us in the state will be working very closely together to mitigate and control this epidemic that we have. So Healthy Food Hospitals demonstrates the ongoing commitment of Michigan hospitals to improve the health of residents and communities and to reduce healthcare costs. Initiatives like this will be important as we work to make Michigan a healthier place to live, work, and play. And now I'm very pleased to welcome Joe Ruth to the podium. Thank you.
Thank you, Director Dazzo.
I think it's quite evident that the warning signs are there, the alarm bells have gone off. It's now talking about what are we going to do about the issues at hand. First of all, let me say that we are very pleased to be hosting today's event here at Sparrow. And while I think that the pursuit of healthy food choices are something we do particularly well here, today's announcement really speaks to a broader issue. Michigan hospitals are truly community stewards. In many cases, we are the beating hearts of our communities. It's not only a place to make you better, but we're now focused on helping you make healthy food choices after you leave our health system. Hospitals are centers of health and wellness. And that's why Sparrow is participating in this Healthy Food Hospitals campaign. Last year, Sparrow was asked to co-chair a healthy food work group established by the MHA, which featured clinical nutrition managers, dietitians, hospital personnel responsible for food supply, preparation, and logistics surrounding the food in our state. This group is comprised of representatives from large and small hospitals, and they were charged with the task of bringing healthy food and best practices to the attention of the MHA and provide guidance and practical implementation of these approaches. One of these nutritionists is here with us today, our very own Christa Byrd. She'll be talking and walking us through some of the findings and recommendations from the Healthy Food Hospitals Planning Committee in just a minute. Before doing so, it's really important to mention one more thing, and Brian mentioned this before. It is about leadership. This campaign is yet another in the many that he had referenced. Michigan hospitals voluntarily undertaking significant efforts to demonstrate and encourage healthier choices across the state, focusing on improving the wellness of our communities. Sparrow Hospital and participating Healthy Food Hospitals are proud to be a part of this campaign. We really look forward to welcoming many, many more hospitals as this moves forward. So without further ado, to really tell us about the participation levels of the campaign, many of the details, one of our very own experts, I give you Christa Byrd.
Thank you, Joe, and thank you all for being here. The Michigan Healthy Food Work Group spent a good part of 2010 developing a program that could help hospitals implement a system so that they could be a model of good, healthy food so they can provide excellent care and excellent food. The Healthy Food Hospitals Initiative gives hospital the tools to be able to implement this system. This will improve the nutrition of the foods offered at the hospitals for the people who visit hospitals, work at hospitals, and who are treated here in hospitals. The Healthy Food Hospital program consists of 4 components. The 4 components are represented by stars, and the stars are achieved when hospitals improve their nutritional content on their patient meals for pediatrics, when they label cafeteria offerings with nutritional information, and when they commit to purchasing local food, which is produced, grown, and processed in Michigan. Star 1 asks hospitals to change their default, non-select pediatric patient menus to meet nutrition standards set up by the American Heart Association. These guidelines help to ensure that children receive proper amounts of fat, sodium, and fiber. Star 2 is accomplished when hospitals transition to healthy beverages. On pediatric trays, the beverage of choice should be milk. It should be free of recombinant bovine growth hormone, and it should be non-fat. When juice is served, it should be 100% juice, and juice should be served in containers that are free of bisphenol A, also referred to as BPA. The American Academy of Pediatrics has found that juice, especially sugar-sweetened juice, can lead to obesity, gastrointestinal problems, and things like cavities and dental caries. So this approach isn't just for kids. When possible, the Healthy Beverages and Healthy Foods Initiative should be applied to adults as well. Star 3 is achieved when hospitals label nutritional content in their cafeterias. Studies show that when parents are provided nutritional information on food choices, they make smarter choices for children. a number of hospitals across the country have already started to label their food items in their cafeterias, and more than 20 states are considering policies right now to require restaurants to label their menus with nutritional information. So this just goes to show that informed consumers are empowered consumers. Hospitals complete STAR 4 by committing to purchase at least 20% of their food products produced, grown, or processed in Michigan. So this is probably the STAR that requires the most coordination by hospitals and will be the most difficult to implement, but is also the most effective and has the greatest power behind it. Michigan is the second most agriculturally diverse state, and yet 59% of its residents do not have adequate access to the healthy foods that they need to meet their dietary guidelines and have a healthy diet. Healthy Foods Hospital has aligned itself with the vision put forth by the Michigan Good Food Charter. This supports increased contributions from the Michigan agricultural system towards Michigan economy. It helps to protect our natural resources, and it also focuses on the health of people, residents in Michigan now and for generations to come. STARs 1 through 3 can be implemented in a matter of about 6 months. And in fact, Sparrow, along with some other hospitals, had already achieved the first 3 stars before attending training in March. STAR 4 is a lengthier goal and is going to take more time, years even, to complete. My co-workers here in the Food and Nutrition Department at Sparrow spent over a year in the past year trying to benchmark and determine our current purchasing standards for Michigan and locally produced and processed foods so that we can set up our goals going forward into the next 5 years. You can only imagine the amount of time and energy and creative input that went into creating this program and 4-Star initiative. Well, I'm representing Sparrow Hospital today and the Michigan Health and Hospital Association Michigan Food Work Group. There are really a number of people who pulled this all together and made this happen. I want to recognize Hillary Bisnet from the Ecology Center and Paige Hathaway from MHA for their great efforts and time and contributions to putting together the 4-Star program. And I'd also like to thank Sparrow's team of associates, including all of our pediatric dietitians who worked so hard to put together education materials to go along with this program under the direction of Michelle Nicolai, our clinical nutrition manager. The Healthy Food Work Group, with contributions from dietitians from MHA member hospitals and functioning as a subgroup of the MHA Green Health Committee, have worked to polish and perfect and guide this program to its completion and the campaign that you see before you today. Also, our gratitude goes to the people who composed the Michigan Good Food Charter, which is the central component of STAR 4. The charter took more than a year to create and involved efforts from the CS Mott Group, the Food Bank Council of Michigan, and the Michigan Food Policy Council, along with hundreds of others all across the state. In March, the MHA conducted well-attended regional training in Novi, Gaylord, and Lansing, and this helped to introduce the concept and the rationale behind the 4-Star program and give hospitals the tools to be able to implement this program in their own health system. As of today's launch, more than 50 hospitals have signed on to the 4-Star program, and we expect that more will be signing on in the coming weeks and months. Michigan hospitals and residents can find more information about the Healthy Food Hospitals program by going to healthyfoodhospitals.org. And now, let me please welcome Brian back up to the podium to conclude our event.
Thank you very much, Christa, Olga, and Joe. We appreciate all of your remarks today and your support. I would like to acknowledge Rob Fowler, who's here with us this morning. Rob is the President and CEO of the Small Business Association of Michigan. We are very pleased to have an ongoing partnership with the Small Business Association in terms of prevention and wellness. And I think Rob and his members certainly understand the importance of prevention and wellness to improving employee productivity, reducing absenteeism, and combating healthcare costs at the same time. So, Rob, thank you very much for joining us today. If you think about the opportunity at hand, Sparrow Hospital and hospitals all over the state very likely serve more meals on an average daily basis, 365 days a year, than just about any restaurant in the community. And so we have an opportunity, you might even say we have an obligation, to send the right message by offering only the healthiest food and beverage options to our employees. Over 200,000 employees work in Michigan hospitals every day, to our patients, to the families and visitors who come through our doors on a very regular basis. We need to send the right message. We intend to do exactly that through this voluntary statewide initiative. And I would tell you, if we're successful, and I believe we will be one of the first, if not the first, states in the entire nation to accomplish such a broad-based, comprehensive, and voluntary leadership campaign. So again, we thank you so much for being with us this morning. Our three presenters will be available privately for a Q&A session with members of the media who have joined us, and we really do appreciate your support. Have a great day.